So welcome back to part two of the origin story. Hope that's why you're here. If not, some of it might not make as much sense to you as it will to the others that went through part one. But here we are. So let's go. So the team of scientists were very, very successful in finding a food chain derived molecule that seemed to have pharmaceutical-like potential. So they were really excited. And they, for whatever reasons, they targeted at one of the root causes of arthritis. So they said that, you know what, this might have great potential in helping people that suffer through with arthritis. So they did all the tests. They went through animal tests, safety tests, all that stuff, and it finally got to human clinical trials, right? So it turns out that more women have arthritis than men, so their human clinical trial test group was proportionate. It was more women than men, right? And they ran into a problem with people on this human trial. And the problem was that women kept falling out of the trial because the trial period was long. Let's just say it was a year, maybe more. That they had the participants had to maintain in the group for that long period of time, but they kept losing women because the women were getting pregnant. And then they realized that the logistic challenge that they were having is that because they needed to test people within different age groups, they would always have women in that age group of people that are, in that baby having time of their lives, right? So they tried to come up with a way. They wondered if they would ever be able to get to a trial um, if they kept having this problem, and then they started to try to work around the problem. Like, well, what can we do, knowing that there is a chance of women falling out? Should we have more women than we started with? They start going through all that stuff when one of the researchers involved in the studies pointed out to them that she found something in the data of the participants' response that was statistically relevant. And she went on to say that the women were reporting a heightened sense of libido. And then the team basically said, well, that's that's at best coincidence, et cetera, because that's just different pathways. They're not even going down pathways that they thought would be related to resulting in a heightened sense of libido. But the scientist was very adamant. She was like, look, data is data. The math says what math says, that this is way far than just an anomaly. It's statistically a thing that you should at least explore. So the team agreed, and they went all the way back to animal studies and started going back to looking at the metabolic impact the testing had on rats, I think it was, and they re-administered, kind of restarted the animal study, but looking for a broader spectrum of things, and lo and behold, they saw that it did seem to have a profound impact on the testosterone levels of the male mice. And then of male and female mice actually. And then they did what scientists do, and they started to try to understand why that was. And a half a decade later or more, they had figured it out. And they realized that there were some very specific things in the hormonal side of things that resulted in the level of available testosterone being optimized. And by optimized, we mean more readily usable in the mice. So then, once they really narrowed it down and isolated it down to the precise molecules, then they had to re-embark upon safety testing, all the stuff they need to do to end up back in human clinical trials, again, for a different target, which being the impact on hormones, specifically optimizing testosterone. And lo and behold, the test bare it out, and it showed a very clear impact on optimizing testosterone in the human body. And that molecule went on to become an active ingredient that you might even say launched the whole natural testosterone boosting or enhancement world of nutrition. The lead brand, there are hundreds of brands that eventually use that product. The lead brand of which is a $1 billion success story, of which we now see the TV's commercials running nonstop. So it was a success. So that was the origin story of kind of, and the first nutrient to market from this biotech lab. But, you know, as they started to get this one down the food chain, they have already identified 3 or 4 different food substances that have the same potential and are at different phases of that scientific process, many of them towards the end of it with the validating through human trials and all that stuff. So the exciting thing about this company is that this company is going to bring to market a host of different, very, very effective food chain sourced molecules that have different types of effect on the human body. The first being the active ingredient is TestaSurge, and it's basically, they took what they learned in that first origin story part I was telling you about, and we're now almost 20 years later, and they know a lot more. They have a lot more types of equipment, a lot more science, a lot more everything, and they found different ways to approach the stuff that their original substance did, active ingredient did, and it's, I think, 3 or 4 times more impactful. So actually, you know what? Let me grab a bottle real quick. One sec. Here we go. This Epic Tea is the first product coming from this newly formed approach for this food chain generated suite of nutrients that are being made available. And some partners and some friends of mine have been helping them launch this new ingredient as they wrap around the ingredient different business models and path and distribution and all that stuff. But right now what we've been doing is getting the product in the hands of people that want to try it firsthand and see for themselves if it makes them feel any different. And what I can tell you is that we can't even keep it in stock. I mean, we literally can't keep the stuff in stock. We get it to people, you know, a week or 2 later, people are coming back, they're like, holy crap, and they're trying to pre-order, order more of the test stuff. Well, you know, so I think this company is on to something. I would keep my eyes open for this company once it launches, and then this is July 9th. So I believe by next week, the company's going to be kind of launched officially, and the first of a few products are going to be made available. But if you have questions or want to try product or things like that, just contact me through one of any direct sources, and you can just say, hey, I want to sample the product, and you know, I know what it is, Epic Tea, and we'll work out how to get it to you. But what I'm excited about is just I'm excited about the philosophy that drives the whole effort. To me, the non-scientist, it does make sense, right? If you can find things that already exist or have existed in the human food chain for hundreds or thousands of years, the chances of it being toxic or not readily bioavailable in the body and all those things are probably fairly slim. And the chance of your body not only recognize it but being able to use it or being able to use it really, really well, to me, the non-scientist, that just makes a lot of sense. And I can tell you from my personal experience of trying the product, you know, I used to see the commercials on TV all the time about the challenge of people having low T, people over 40, your test goes down, blah, blah. You've seen all those commercials that flood the TV and the internet. And you know, I never felt like I had any of those symptoms. I'm 59 years old. I'm still very, very active, work out quite often, super active, feel great, no brain fog, no problem with any of the drives, any of the human drives, right? I would, if you asked me how I felt, I would have told you, great, I feel good. Of course, I feel a little bit older because I'm not 20 anymore, so I can't do some of the things I could do when I was 20, maybe 30. But most of the things I could do at 40, I can still do, right? So I thought I was really well, but I can tell you after a couple of weeks on the product, what I became aware of was that it wasn't that I wasn't feeling some of those symptoms like low energy or whatever it is. It's just that they happened so gradually over such a long time, I guess, that I didn't notice them, and I just came to call that normal. What was normal for me? Now I still would say I felt great, good, but it felt normal. But it's not until now that I can tell, oh, wait a minute, that wasn't normal. I mean, that wasn't feeling great. That was just feeling normal. Because I can definitely feel the difference. And I felt what I was hoping I would feel. And that would be in the associated with testosterone, the zest feeling, the not aggressiveness, but aggressiveness for life, right? For taking action. I call it the go do something mood, the get some mood. I definitely feel that, right? So, and that didn't take me long at all, but I'm very self aware. So I've been a fan now for about a month. So, and that I love the difference I can tell between what I thought was good and but was normal. Now the fact that I can understand that that was just an adjusted normal. I couldn't even feel it. I wouldn't even known I was there until I looked at there from here, if that makes any sense. So yeah, I'm super excited about being a part of helping this company bring a host of, when I say host, a handful at least of these new powerful compounds, all from the human food chain to market. So I would definitely follow me or reach out to me, or I'll keep you in the loop. I'll probably start some kind of group or update or something. Or as the new products come to market, I'll probably do a similar origin story of how they found the plant and slash molecule and what it does and what the positive effect um, it has on the human body is as they start to happen. But that'll probably be over the next few years because the process is very, very time consuming and meticulous, and there are a lot of things they have to go through in terms of the labs and the testing and the safety protocols and the studies and the trials and all that stuff. But I do know because I talked to the scientists, I know of at least two other food sources that they're all the way at the end of that process. So they're going to be coming to market fairly soon. So welcome to Origin Stories, and hopefully you can appreciate that there are companies out there that are literally trying to do all of it, right? They're trying to not just treat symptoms, but treat causes in a way that has a possible effect over a long period of time, and also in a way where the people in the food chain, like the companies and distribution and all that, can actually make some money. Because those are usually the things that pharmaceutical companies will use as rationalizations to not necessarily do the right thing, right? That because people, it needs to happen right away, it needs to be of a certain potency, it has to affect right away. They're not really, I don't know that they really, they warn people about the side effects, but I don't know that they really embrace the side effects or the potential damages of the side effects, like the users might, right? They just tell you that long list of things that might possibly happen that are not good if you take their drug, knowing that people are going to take the drug anyway. And then they say that, it costs so much money to do all the research and all that other stuff and blah, 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 blah. That's why the drug needs to be so expensive, because they have to recoup all that R&D money. And all of that might seem logical to the ones that want to justify it, and some of that doesn't seem logical to the people that don't want to justify it. I'm not trying to pick a side, but I'm glad to have found a company that's not in that model. I like the model that they're in, and I think food source generated molecules are genius. Now, I'm not a genius, so that's not a genius qualifying a genius. It just seems genius to me.